I'm joined now by our own Dr. Joe Sirven, who is, of course, a regular on the show. So I'm in the rookie seat today of the Saturday WJCT program, What's Health Got to Do with It? And welcome, Dr. Joe.
Hi, Al. What a pleasure to be here with you on Veterans Day. I want to echo your statement about veterans as well, but it's such a pleasure to be here with you.
Well, good. We're going to have some smiles. We've already found some remote connections already in
That's
the
right.
few minutes we've been together. It's the small world of the small world. Obviously, we are going to be discussing medical news. Also, Dr. Joe's going to answer your healthcare questions on really any topic, even though we do have a swim lane today. You can reach us at 904-549-2937, or you can also email us at firstcoastconnect@wjct.org. Let's jump right into the topic of the election, Dr. Joe. It's behind us, ish,
Right.
but many with are still grappling with the impacts and the aftermath, especially those feeling frustrated or upset that perhaps their candidate or their topic, the item they were impassioned by, did not pass, or of course their candidate didn't win. From a medical standpoint, can political stress affect both the mental and the physical health?
Yeah. From a medical standpoint, the answer is an absolute yes. There's no question. We walked into this election, if you look at it from a health standpoint, with already a very high level of general anxiety. We
Mhm.
know from surveys, from diagnostics that have done studies of populations over the US that we already sit with a lot of people who are very anxious. Political anxiety adds that extra element because there's so much of an echo chamber of what's going on. I remember right before the election how it was always staged as existential on both sides. This is your
Mhm.
life, and there may be truth to that, of course, but yes, this can have very big impact, especially now as you grapple with the outcome on whatever side that you stood on to kind of say this is going to be the reality, and how does this affect my life, if you will.
Yeah, and there's some scary and hairy data to reflect that. Political concerns top the list of stressors on the American Psychological Association's 2024 Stress in America survey. And then also, some recent research came out that 77% of U.S. adults said the future of our nation was a significant source of stress in their lives. I I listened to that comment, the state of our nation, the future, and that can weigh super heavy. How does it begin to manifest itself? What does that stress look like?
Yeah, so stress like that basically can have any of the typical things that we expect to occur physically. So it could be from a physical standpoint. I start there. It could make you suddenly want to compensate with uh, drinking more if that's a habit, smoke, pick up bad habits of some sort. Maybe you find yourself with your blood pressure going up. You can't sleep like the way that you were able to.
Mhm.
You may ruminate on this, and that's very easy to do, especially if you spend a lot of times on social media scrolling through, or you're listening to uh, uh, to television or some type of radio or podcast that kind of just reflects this back at you. So there's all these possibilities of it really just throws off the key things that we all need for good health: food, exercise, things of that sort.
So this just brings up the question then, that type of stress, because it's in a vacuum, if you will, could almost mask other serious things, couldn't it?
You basically start blaming anything that's going wrong on the outcome of all of this, which is
It's
which is
just politics. It used to be, it's just football. It's just a game, just the Jaguars. But
exactly that. That's another sports stress is another item, but we're not here to talk about that one.
right, right.
But yeah, that you can somehow kind of lead yourself there. And if you find yourself you're just not sleeping, you're eating poorly, doing like picking up bad habits, if you will, as a way of masking, that may tell us that that's where we need to kind of write ourselves back to whatever a place of health that we need to get to. But it's a real thing.
You started to touch on this. I'd like to go a little bit deeper. Um, is there a uh, is there a difference between the political anxiety and how it shows up in the typical forms of anxiety in like a really diagnostic kind of physical way I'm talking about?
Well, there's what's unique about political or election anxiety is how there's two components to it. One is the fact that it tends to be less positive and more on the negative. In other words, you tend to kind of have go towards anywhere from despair to anger, depending on your outcome, and that is a little different from just generalized anxiety, where you're just concerned.
Mhm.
Number two, there's a social piece to this. In other words, you can find yourself blaming others or people that you disagree with very quickly, and that tends to isolate you more. So it has more of an isolating effect in your own for some people as opposed to others. How it looks physically, if you're going to
Mhm.
see a physician or a provider of some sort, is probably going to look similar to general anxiety, but the ultimate root causes are slightly different because of that social aspect of it and the range of emotions that can kind of occur with it. And that's what kind of gives it a little bit of a difference, because it can hurt you in a couple ways, because that isolating factor can be very problematic, actually, both socially and for the person. Because humans, at the end, we like being in groups. We
Mhm.
sometimes we may not act like it or may not feel it every second of the day, but we are a social being.
Well, and I mean, isolation, mental, physical, is a dagger. It only
Exactly.
puts us, and we're also so inclined oftentimes to just slough it off as a headache or a this or that. And so if I'm hearing you correctly, this is obviously real, and this is something that people should take a more proactive approach to being conscious and aware, maybe?
I think that's the right thing, and then we also have to kind of now really find ourselves to find ways to put this in some form of acceptable perspective. In other words, channel that energy, the negative energy, if you will, whatever that's kind of that you're focusing on, oh, woe is us and all that stuff, into some type of action or feeling of that you have control. And that does
Mm.
can occur individually.
Yeah, I mean, wow, what a powerful statement, because at a point when sometimes you can feel so out of control, that is the one thing you can, is the decision, the choice. And that would extend as well to the conversation, I'm assuming, with your physician. I could imagine somebody saying, "I'm not gonna call SureCare. I'm not gonna call whatever. I'm not gonna call my doctor. I'm not gonna bother them," or for fear that maybe it would even be a tough conversation from a political standpoint. So how do you recommend somebody explain what they're feeling and their fears to their physician?
I think at the end of the day, what I would always say is that if when you're talking to your doctor or provider, whoever you are seeing, be upfront. Number two, point out what are the health pieces that are impacting you. If you're not sleeping, if you're ruminating too much, let them know that this is causing a concern or a problem. They will probably try to put you back in perspective, kind of say,
Mhm.
hey, this is what you can do, and that'll may give you a sense of control, but just lay it out there for them so that they know they can best help you.
And isn't that really the right set, is that we need to come to our physicians from the standpoint of long gone are maybe the days that it's just you're just seeing them for this one thing. You really should be able to be in an environment where you can be transparent and open. Isn't that what you're saying?
Absolutely, you don't wanna lie or or be dishonest or downplay it. The healthcare system is busy, and so what you don't wanna kinda just play into that busyness. Lay out, "This is my issue. This is where I'm concerned. What advice or suggestions might you have?" Make it actionable so that you get actionable things that you can do to assert that control for yourself.
What about documenting what you're experiencing?
Well, that's always in that could be therapeutic in its own route, because we know journaling sometimes, if you're writing all this stuff down, when you that act of writing and putting thoughts around it can be very helpful, because when you go out to kind of like read it and process it, it can give you that extra perspective even before you pick up the phone
Hmm.
to call someone to give you a sense. Because one of the thoughts in terms of how you even manage a political anxiety, the technique is something called cognitive reassessment or cognitive reappraisal. It's a fancy way of saying reframing it.
Hmm.
I'm going to try to find the positive streak here. Or I'm going to look at this as a third person and add some extra perspective to say, well, this is what one can do. Try to eliminate the emotion out of it, as easy as it is for me to say, and try to look at it from a very objective third person view, if you will. And sometimes it gives you the aha moment to kind of recapture where you are and kind of get a hold back.
Wow, way to just make something so technical sound so human. Thank you for that, Dr.
You
Joe.
bet.
Speaking of being a human experience, this is a human experience. There is no artificial intelligence in this studio right now. Well, okay, I might wear that hat, some of my friends would say. So please humanize with us. We have Dr. Joe with us today doing his house call at WJCT. So call us and join us with your question, 904-549-2937. And you can also email firstcoastconnect at wjct.org. I'd like to move now into, it's still related to the
Sure.
political conversation, but there is a lot of discussion in the LGBTQ community about how the impact of this election could physically show up in that crisis. And I say crisis because the crisis hotlines nationwide are reporting a surge in calls leading up to the election. And since Trump's victory, many callers expressing that loneliness you were talking about, the fear of losing access to gender affirming care, and concerns about physical harm due to their gender or sexual identity. So, how much of an increase are these hotlines experiencing?
Yeah, I from what I have seen, those numbers have gone through the roof from almost every state because that sadly that is they've been a target
Mhm.
to be blunt, and as a result, that has that very isolationist vibe for it. So a lot of people who are in this community who are very nervous, who are anxious about what the future holds, and this is another one of those situations where taking action to help yourself if you're in those communities or a loved one or family member to help these folks out. In essence, we're all people. We all are coming at it in the sense that we're all living in the U.S. We all are under these same type of rules. The key is to kind of not find yourself isolated and try to take that personal action that helps. Again, easy for me to say,
Yeah.
but what we want to do is just surround yourself, especially, and I speak to those in that community, with people that affirm you, that that like you see the goodness and the things that you contribute, and sometimes easy to say again, but there are always folks out there that are there to help, and those crisis hotlines. That's what they're going to tell you. So support groups, community, finding folks that are like that's. I think it'll be the key, certainly as we kind of walk through this.
And from a blocking and tackling, it sounds like you got two things occurring here. First of all, you have the transfer of power to President Trump, and then you also have the change in insurance, the
That's
um, healthcare exchange. So, any advice on getting into those appointments now and getting those things booked or trying to?
I think that the smartest thing is to get. I would even if there wasn't an election, anytime before the end of the year, this is the time to do things before insurance changes occur. November is always the month of sign up for insurances. Get everything lined up. Do it now. Don't wait. Don't be a procrastinator because we don't know how things are all going to look for the upcoming year. This is the time to make those appointments, get things lined up, because that will put you in a better position with regardless of how things all shake out from a legal or marketplace standpoint.
And that's really for all communities.
Every community, it doesn't matter who you are. This is the time to take care of it anyway.
Last question on this topic. Uh, in the past, and according to the reports, as well as what has been publicly stated, the Trump campaign, has pushed for exemptions that would allow healthcare providers to refuse care to transgender people, in addition to people with HIV and AIDS. Even more of a reason to get in now. Um, Previously, in comparison to what we're seeing moving forward, from a clinical standpoint, what are your thoughts there, and what do people need to know?
I think at the end of the day, one thing I will tell you, regardless of who's governor or president or senator or congressman or woman, um, physicians and providers, we're all here to help. I am hard. I mean, we all may fit the whole political spectrum from a healthcare workforce, but I can speak this very comfortably. Of all the places I've been to healthcare wise, people want to help in healthcare. No, it doesn't matter what stripe or politics that you ascribe to. And we all have oaths to help in that regard.
Yeah, and that's important, and we have an oath to keep the ear and the eyes of our public engaged, and so we're gonna do just that with you. And we have, John from Riverside who wants to, share some of his thoughts. John, welcome to our program this morning.
On the LGBT, I'm a gay man. I've been out since 1972. When I came out, people thought I was out of my mind. In fact, other gay people didn't want to associate with me for fear that they would be outed by that association. I fought the long, hard battle, insisted upon I went where I wanted to go and worked where I wanted to work, and dealt with what I had to. As things improved faster than I ever thought. When I finally heard comedians joking about having a gay experience or something, I realized that we had gone over the threshold. And very shortly after that, gay marriage was approved and things like that. I never believed that homophobia went away, that we've been transformed. So I fully expect to be facing more. This will legitimize homophobia. And the people that will attack us are vicious people looking for a victim.
Right.
They could and would attack old people if they thought they could get away with it. But on a greater thing with this issue, we can call it anxiety or something. Sometimes there's legitimate concern. My house insurance rates are going through the roof because the insurance companies insure against risk, not certainty. Global warming is
Hey,
here. We're
John,
dealing with it.
John, I'm
hmm
so sorry to interrupt you. I so believe and appreciate your passion, but I really want to go ahead and bring this to a comment for what you said, and I'm going to allow our good doctor to respond to your earlier statement, which I think you kind of touched on, which was you've got to invest now and take the time to seek the health care, but most importantly, protect your mental state.
Absolutely. There's that's I can't say it any better, Al. This is the time to just be proactive in that regard. I will give a sense of hope. The younger generation, they are very, very
Mhm.
open and accepting. I'm going to hope that that carries the day with due time as we move forward.
Well, we have a few minutes left here. I wanted to just touch on the conversation around fluorinated drinking water. It's named one of the top 10 public health achievements of the last 20th century by the Centers for Disease Control and Prevention. However, Robert F. Kennedy Jr., potential leader on health initiatives um, in the new administration, has called for an end to this practice. Um, I know I'm loading it up at the end of the program here for you, for well, the end of your segment. But what does the medical science say, and are there really valid concerns here, Dr. Joe?
So this is when it comes to fluoridation, there is one element of nuance, and this has to do simply too much of anything is not good. A little bit of something can be really good. Fluoride is a perfect example of that. At a low level, what's accepted for what we use in the U.S. for water fluoridation, it really helps to save on dental cavities. And I love you all, dentists, but I don't like going to go dentist to get my cavities filled.
All right.
So if you ask the folks in Buffalo, New York, they went through stopping fluoridation, and then they had it just restarted because the cavities went through the roof, and there's a dental shortage in the U.S. We don't want to go back in that direction. However, in fairness, if you like, had an industrial accident, you dump fluoride into water, Yeah, fluoride could be a problem at a toxic amount, but so can anything that is done at a toxic amount. But at low levels, it is a true achievement, especially in helping prevent dental cavities.
So what makes it so powerful as a preventative?
So it helps to prevent the acid that occurs in natural in foods and that causes cavity. It helps to kind of protect that enamel on teeth, if you will. And as a result, that's what helps it with preventing dental cavities, and that has been a huge benefit in terms of preventing that, especially in people who don't have dental access. Then you are stuck with dental cavities. And I might add, dental health has consequences for the rest of general health if not managed.
What can the public do now as s maybe some folks are advocates, some people agree with this approach. Um, what does the public need to know now as they prepare for a potential change in some sort of a
I think
policy?
this is the moment to be vigilant. In other words, there will be some things that maybe we all agree on, and there may be some things that we should not be agreeing on. This is the moment to now educate ourselves. We all have to be healthcare consumers, science consumers. This is the moment because people are looking at all of this and see where we all feel with it. So get involved and don't turn off the radio, podcast, or TV to some degree because we need to be educated on all of this as well.
This is just a very quick technical question. When you're shopping for the toothpaste, there's some that are like the 0.45, some that's a 0.2124. Is that a do they negate each other? Is there really a difference?
Not there. There isn't. I know. I look at those same toothpaste elements. Most toothpaste have fluoride. Think of it this way: some people get milk that says calcium added, or orange juice that has calcium added. It's the same type of concept. I don't make too much as a big difference because at the end we're all getting fluoride from the water anyway.
All right. Dr. Joe, thank you so much.
Al, it's been such a pleasure.